Hello, and welcome to Change the Face of Yoga, teaching toddlers through golden oldies. I'm very excited to be talking to lots of yoga teachers who will explain their passion for teaching yoga to students with different ages, physical fitness levels, wellness levels, and different goals. They will explain the benefits of yoga for these students and will be including teacher tips and pose modifications. I am Stephanie Cunningham of Yoga Lightness, and I've been teaching over 50s for 10 years. So this area is my passion and the passion of many other yoga teachers that you will be listening to in this series. Thank you so much for listening, and let's get started.
This is episode 114 of Changing the Face of Yoga. And I have a very interesting guest today. This is Dr. Shailla Vaidya. Not too sure about that last word. She is a physician, a yoga therapist, and a compassionate change agent practicing mind-body medicine in Toronto, Ontario, in Canada. She completed her MD at Dalhousie Medical School, a residency in family and emergency medicine at the University of Ottawa, and a Master's of Public Health in Health Management and Policy at Harvard. She has had her own experience with physician burnout, and she created the Yoga of Burnout Recovery Stress Resilience Program, which combines yoga practice and philosophy with the science of human function, self-compassion, and stress resilience. Her current medical practice is focused on helping her fellow professionals and others with stress-related illnesses to regain their health and well-being. She's also a certificant of the International Association of Yoga Therapists and teaches medically informed therapeutic yoga to yoga therapists internationally. Welcome, Shailla. I'm really glad to have you on. I think this is a really important topic. Is there anything else you'd like to add to that introduction?
No, I did change the name of the program to the Yoga of Stress Resilience Burnout Recovery Program, only because burnout has so many things to prove that it's actually burnout you're fixing as opposed to stress. So it's actually the Yoga of Stress Resilience Burnout Recovery Program.
Okay. All right. I will make that change in the context. That's really a good place to start then. What exactly is burnout? And let's, as opposed to being stressed.
Yeah, so, burnout was first described by Dr. Christina Matlock at the University of California Berkeley, and she described it as having three components. I think we all use burnout in a very colloquial way, but the three components are emotional exhaustion. So many of us had the experience of not being able to mentally handle yet another thing, though we may not always recognize or acknowledge that state. So just being emotionally tired is one part of it. The other part of it involves depersonalization, and that's kind of a fancy word to kind of say that we go numb. We're not really human anymore. We're not feeling as we used to feel, and that usually occurs when we're overwhelmed with a lot of the feelings that we face. A lot of the people that we come in contact with who are suffering with pain and grief and so many other things. And as we get exposed to that over time, we may lose our ability to feel empathy for people who have that because we've been exposed to it so much. And then the third thing is reduced personal accomplishment. And this is the feeling that we're no longer effective at our jobs. We start to view ourselves negatively in regards to our work and with the people we're working with. So we kind of feel negative and we don't feel like we're accomplishing anything in our day. The World Health Organization also just recognized burnout as an actual thing, not so much a diagnosis. I don't know if it's a medical diagnosis, but they did give it an ICD-10 code. So a diagnosis and such, but mostly related to one's work. So that burnout is related to the jobs that we do. And there are many, especially as women, as caregivers, and other people who are caring for people in our community.
Okay, so it's actually a very specific thing. It's I agree with you. That term kind of gets bandied about a lot, but there are some ways that a person could say, yeah, I'm having those kinds of issues. And if they do feel that maybe they are, what should they do?
Well, so that's the big thing. I mean, we all kind of say, "Oh, you need to take a break. You need self care," and that's kind of a hard thing because we put self care. We kind of make that the job of the person who is experiencing the burnout, and not everyone is really able to understand that or understand what they need to do to get out of this cycle of burnout. And essentially, it happens when we've had chronic stress. Um, the big thing what really have to do is start to release stress, and as yoga therapists or yoga teachers we kind of know that stress builds up in our body, and completing that stress response, releasing stress from the body, is a real big component in helping recover from burnout, because there's some neurologic things that are happening that when we hold stress in our body, we're sending signals up through our brainstem, through our limbic system, particularly around the thalamus. And of course, this is far more complicated than the breakdown I'm giving right now. But our brainstem or our thalamus, and our limbic system can actually shut down those signals. So we don't actually know we're experiencing the beginnings of burnout until we're exhausted and we can't do anything. So yes, take a break, but also do the things that help reduce or release the stress from our body as we give ourselves that care. And there's so many components within that. But yoga happens to be a fantastic technique to help people with burnout.
Okay, let's explore that a bit more. I noticed. Why don't you explain your program? I think that might be the easiest way to do it because it will give us specific information.
Yeah, so I get referred a lot of people with stress related illnesses from their family doctors, and so they've had chronic stress their whole life. And actually, when I do their histories and do their assessments, I also do adverse childhood experience scores. So the majority of the people I see also had as a child. And so their nervous systems kind of developed under stress. And that may make them more stress responsive as they leave that environment and go on to the rest of the world. What's so interesting is a lot of people who had stress as kids tend to pick, and who survive that, who do well with that, tend to pick professions where they want to help other people. And, I always joke with them that, you want to help other people the way you weren't helped as a kid, or give back in that way. And so it's very interesting. And I can't, generalize that to the whole population of burnout. I'm really only looking at the people that I see come through my door. And so adverse childhood experiences is huge. The way I use yoga is yoga really helps us reintegrate the body. So we know that yoga is more than just the asanas that we practice. That with the Yoga Sutra, kind of, which says, it's a process of slowing down the racings of the perceptions of our mind through this process. Having people come in who are just exhausted, their bodies can't take any more, and then using a restorative approach and a bottom-up approach to help release tension through the body, and then work with breathing and pranayama techniques so that they can, exhale and start focusing their mind on other things, is very effective when we bring them to those places of concentration, meditation, and maybe hopefully bliss. But learning how, first of all, to have compassion for the self and take care of the self, because so many of us put others before we put ourselves. So my program really helps people come back to that self-care component, taking care of themselves, by actually stopping and moving and releasing the stress and breathing, and then learning how to have compassion for the self, much like they have compassion for the other people in their lives.
Okay. All right. I noticed on your website that you have several supportive resources, shall we say. I think you have like a drop-in where people can just come and meditate once a week or so. Is that correct?
Yeah, I usually run that in the summertime for people to help keep up with their practice. During the spring and the winter and the fall, I'm usually busy with working at the medical aspects of yoga. Yeah.
Okay.
But I had that drop in because a lot of people, after they've gone through my program, find that they can't find a yoga class that is like what I teach, which, there's tons of people out there teaching yoga. And then to find a good restorative class, which is what they need, might not always be available to people, or they might not feel comfortable going to their local yoga studio for whatever reason. Mm-hmm.
Yeah, that happens a lot, unfortunately.
Yeah.
So when you've got someone who you have diagnosed as having burnout,
Mm-hmm.
uh, are they really pretty open to coming to your program, or does it take them a little while to really accept that that's what they have?
Yeah, that's a great question. I work with a lot of family doctors who've assessed their patients over time, and some of my patients have had, um, back pain or migraines or other stress-related illnesses, and they've seen specialists and a lot of other people who can't give them the quick fix or the understanding. So when they come and see me, they're usually recommended by somebody they trust, their family doctor. Many of them have never tried yoga, and so they are hesitant at first. But when they come and they meet me and they see they see my setup, my room, my yoga room, and I explain to them the mind body connection and why they may be feeling why they're feeling, I get buy-in that way. And I do a lot, like I'll talk about anxiety and depression and sleep. I screen them for those things. I screen them for their disability score. And as we're going through the screens, I kind of bring them to that. Like they start to realize, well, yeah, actually, this is a problem for me, and that is a problem for me. And I'm not surprised at this score on the clinical scale that I use. And then I actually tell them how yoga can work for that. That when we connect, that when we release stress from our body, how that affects our physiology. So I'll teach them about their vagus nerve, teach them about their heart rate, teach them about these other things, and they get buy-in because at that point, they just want to see somebody who gets it. And when I can explain it to them that way, I think it gives them a sense of agency that they understand what's happening. And then when they actually come to the class, which I think is the biggest thing, the assessment, I really build that trust with them, or I hope I do. When they come to the class and they realize, my God, I'm not alone. Like there's other people who are going through the same thing, who have had similar jobs or a job I can relate to, or are caregivers to elderly parents, or have children who are also autistic. I think once they see that group and they start the program and they feel like they have the experience of what it feels in their body to practice, that's when I really get the buy-in, I think. So.
Okay, great. So it's really a combination of information and building trust and kind of a relationship with them. Is that a fair thing to say?
Yeah, I would say. Mm-hmm.
Okay, so let's move on. I think we have a general idea of what you do, but you say you also teach medically informed therapeutic yoga to yoga therapists. Mm-hmm. Is this in the burnout area or just more generally than that?
Yeah, I'm a part of the Savasta yoga therapy training program. So even when I was going through my training, there would be medical things that I would bring up and offer advice around that type of thing. Mm-hmm. So we're building our yoga therapy training. Savasta training, I'm not certain if you're aware, that's led by Dr. Ganesh Mohan and his family.
I've heard of the Mohans, yeah.
Yeah, so it's through the Mohans, yeah.
Okay, and so your training is basically through this this particular yoga training opportunity that's available.
Yeah, and I've done talks for the Montreal International Symposium of Yoga Therapy, and I've also done a few things. It's a little bit more informal, but with licensed healthcare providers, we call them allied health here in Canada, who have yoga teacher training background, and they want to apply some therapeutic skills, some therapeutic yoga skills with their patient population. So that's the type of stuff I also do as continuing education.
Okay. So
And in that format, I often just call it mindfulness.
Okay. All right. So when you're helping professionals, like medical professionals like yourself or others, do you find them open to yoga, or do they take a little convincing?
By the time they get through my door, they're open. I'm sure there's family doctors who mention this to their patients, and they might not be open. But a lot of the people I get also come word of mouth. So they had a friend who had gone through my program and who was a social worker, and they were a social worker with burnout. And so by the time they get referred, they have buy-in already. So I think I probably have a biased population. Um, but we know the science of this stuff. And also, I think what's really fascinating about the time that we're at is I do have a lot of support from my medical community. Many physicians who are specialists who know of what I do find it very interesting and will start to refer to me. So I get referrals from neurologists and psychiatrists, cardiologists that have been interested. So that I think more than anything is the support I get from my medical colleagues to do this work. It shows that they are interested and that there is buy-in.
I think that's great. That's wonderful. Okay, so if you could give this, my typical listener is either a yoga teacher or a yoga therapist. What kind of advice would you give to them if they think they might be experiencing burnout?
Yeah, I would just tell them that it's real. A lot of yoga teachers are doing trauma informed practice now, and a lot of yoga therapists are. And just to understand that there is such a thing as secondary trauma, vicarious trauma, traumatization, that we resonate emotionally with the people who we work with, and that's your neurons or our limbic system picking up on the emotions of others. And we are designed as people, as humans, to do that so that we can aid another person. But what the science shows is we actually feel that other person's pain as if it's affecting us, as if we're experiencing it. And so just so people should know that, this is real. You are feeling that heaviness. You are feeling the person you're working with, you're feeling their heaviness, you're feeling that pain. We have science to show that, brain scans to show that. And the most important thing is that we as yoga teachers and yoga therapists also have a tool that we can use, and that is fostering and developing compassion within. That when we can start to use those meta techniques to breathe in compassion for ourselves, to name the pain that we're feeling, then we can start to reduce our own empathic distress and our own empathic resonance. So we're still resonating with them, but we're dealing with what we're feeling. And then as we start to generate that compassion within, because compassion works on a different neural network than empathy, we can actually hold space or be able to be there for our clients, for the people with whom we're working.
Okay, great point. That actually working with people with trauma can have an effect on the teacher or the therapist. You see a lot of trauma training, and I haven't taken it, so I can't say, but I hope that they're also looking at the well-being of the person giving the yoga. So we're almost at the end of the podcast, Shailla. Is there anything that you would like to talk about in more depth, or in something that we haven't covered at all?
No, I think those are the biggest things. I think that what I would like to do for the people who are out there is just to know that there are techniques to read about, even the mindful self-compassion program or compassionate listening programs, so that they can start to employ those techniques when they're working with those who have trauma, and to recognize that it might not appear the way they think it's going to appear in them or the others, especially when you're working in a trauma-informed practice, to recognize that you may also be triggered by something, and that's completely normal. And as time goes on, you may start to get triggered simply by working with people who've had trauma. By hearing their stories, you may start to develop that secondary trauma pattern or that vicarious trauma. And you may actually also develop what we call moral distress or moral injury. Moral distress is when you know what to do for someone, but you can't do it. And moral injury is when you feel like the system within which you're working is not able to support what you feel needs to be done in that time. That these are things that helping professionals deal with and that are real and that lead to burnout, if not and beyond, right? So I think for my biggest thing is that people should have an understanding of who they're helping and why they're helping, but also the effect that it can have on them.
Okay. Do you have any resources? I mean, we've kind of touched on it very briefly, but it sounds like an important thing for people to understand and be able to handle.
Yeah. So resources, I know the Center of Mindful Self-Compassion, based out of San Diego, California, has a website on some of these things. Books. There's a fabulous author, Laura Vandernoot, who did a TED Talk on secondary trauma and vicarious traumatization. Babette Rothschild is a person who also wrote a book on helping the helpers. So there's resources out there, I think, that people can explore around this.
Okay.
Yeah.
No, that's great. That's great because I didn't realize that. I mean, it makes perfect sense once you say it, but that, you helping these people who have trauma could be is very satisfying, I'm sure, but it can have some other things that you may need to be aware of. Well, this has been a great podcast. I learned so much. I love podcasts where I learn a lot. So thank you, Shailla. You've done a great job, and you're an excellent speaker, which is always really nice. And I think you're doing a really great job, especially like this kind of amalgamation of the Western medical, and the yoga, because I think they do go well together. They complement each other, but some people, sometimes it's hard to do that. So I congratulate you, and thank you so much for being on the podcast.
Yeah, well, thank you so much. This is actually my grandfather's dream. My last name Vaidya means Ayurvedic physician. So he always wanted his grandkids or his kids. He wanted his kids, but that didn't happen. He wanted his grandchildren to blend the two, to not lose this culture. This, so much was lost under colonization, and my uncles were jailed for, my uncles and great uncles were jailed to try to keep, as they were trying to keep these things alive. So, for me, it's really an honor to be able to speak on this stuff and to be able to combine these two. So thank you for having me.
Oh, you're welcome.
Thank you for that wonderful interview. If you would like to be a guest on Changing the Face of Yoga, please go to my website, www.yogalightness.com.au, and under the Changing the Face of Yoga tab, you can complete Be Our Guest form. After reviewing the form and finding it applicable to this podcast, we will send you a link to schedule an interview. Please download, review, and tell your friends of any podcasts that are of interest to you and to them. If you would like to contact me, send an email to info@yogalightness.com.au. And thank you for listening to Changing the Face of Yoga.